Good morning.
Okay, you said you still hear feedback, so I'm gonna have to.
Okay, let me. I don't. It's not as bad now.
Okay.
It might be okay.
Good morning.
Good morning.
I feel like I missed y'all forever. I was nervous, but I was so confused because the time difference.
Right.
We went to Vegas and the time difference, and I'm like, did I miss it? Should I jump on? What's happening? I was confused for days. Let me just say that. And then we caught a red eye home. So I was still confused for more days when I got home. Like, what? It's 5 o'clock in the morning. What am I doing up? How y'all doing? How you doing?
Good.
Good, good. How was your week?
It was interesting. We have a lot to talk about. Some of it on Clubhouse and then some of it backstage.
Okay, so I have time for backstage today. Good, good, good. Okay. All right. Well, I guess let's get this little party started. Good morning, everybody. And welcome to our Saturday morning tea, where we discuss health information, news, education, and certification tips. I'm Clarice Warner. I'm the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And before I introduce my wonderful, wonderful friend and co-host and family, today's episode is sponsored by the Professional Reimbursement Network's free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Yes. So if you are interested in knowing more about those 5 steps to become a certified marketable medical coder, and you are in Clubhouse, feel free to click the link at the top of the page to get more information. If you are on YouTube and Facebook, you can check the video description for the link. And trust and believe there are benefits to that as we do our classes. Those of you who've gone through the 5 steps email course get a little bonus link for some discounts for our classes. So if you are in that realm where you're looking to potentially be certified, you're looking for courses, you're looking for all of that, click that 5 steps and see if there's something that's beneficial for you. Alrighty? Okay. So joining me today is my co-host, Mr. Jesse, the registered trademark. I love that still. The coding nurse. So introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been an LPN for 29 years. In 2014, I transitioned into the world of medical coding, and in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other healthcare professionals with clinical experience transition into the world of HIM.
Fabulous. Fabulous. Okay. There we go. I say, look at me. Okay, it's coming back. Slowly but surely, it's coming back. All right. So if you are in Clubhouse and you want to join in and add to the conversation, please raise your hand. We'll be checking. Don't be shy. Your opinions matter here and is welcomed here. So come on up to the stage. And remember, it's a training ground too, because if you're new and never been to a stage, here's an opportunity for you to see what that stage stuff looks like on the other side. Sometimes folks may be intimidated, especially when they're in larger rooms and or even in smaller rooms where they have it on lock. Trust, I've been in a couple small rooms. They got that it's on lock. But we'll allow you. Now, I've raised a couple eyebrows a couple of times for some folks that I don't let come up to the stage, but I still let everybody come. Come on up to the stage, um, and give your opinions. For my Facebook and YouTube friends, you all know what to do. You place your comments or questions in the chat. If you are using the chat or comments function or feature, make sure, and you have a question, make sure you put a Q in front of it so we know it's an actual question and we can make sure that we get to that versus just, giving your thoughts. And as always, make sure you use the hashtag Saturday morning tea. Yeah, yeah. Let's get some engagement and traction on our stuff. Okay. So we didn't get all the housekeeping stuff out of the way. Let's get into what's going on. What's going on?
Well, I wanted to know, have you seen the new AHIMA pass rates that they released?
No. Oh Lord.
Oh,
It's bad.
bad.
Across the board or just in
Across,
certain?
well, there is a decrease across the board,
We talked about that yesterday, and we'll talk about more on that. But go ahead.
but
Here's some tea.
because I did some calculations, the biggest percentage drop is 49%, and it's for the CCS.
Wow.
In 2020, 83% of the people passed on the first attempt. In 2021, it dropped to 42%. That is a percentage decrease of 49%.
Wow.
The
In 2021?
Yes, a 1 year difference.
So I wonder if the pandemic will be the reason for, or potentially because of especially if they transition the school, if they were in school and didn't, well, I'm talking out loud. Go ahead. I'm sorry. I'm looking for a
And
why.
the next largest percentage drop is the CCSP. That was a decrease of 37%. In 2020, they had a 67% first attempt pass rate, and in 2021, it was 42%. The smallest percentage decrease is the CDIP. It was only a 9% decrease, but it was a decrease across the board.
But that's small.
Yep. And the art, because I did it by, I did it by like the largest, because the largest, well, their most popular certifications are the CCA, CCS, and the RHIT in terms of numbers. No, it's not. It's RHIT, CCS, and RHIA. So in RHIT, it was a percentage drop of 12%, and RHIA, it was a percentage drop of 22%.
Interesting.
Yeah. So I found that interesting, and and because I know that they did change the exam where you can't mark the questions and come back. You have to go straight through.
We talked about that. You're right. You're right. So I probably that coupled with and my thought, or I was thinking, pandemic restrictions because people weren't allowed, schools shut down, or they went from in person to virtual, and if you weren't, that was sort of hard for a lot of people if they weren't used to a virtual classroom or doing online courses. That transition could have potentially been difficult. I don't know, I'm just kind of factoring that in there too as well. Oh wow. Wow.
So I wonder how AHIMA is going to address it.
Interesting. I wish I would have known that because I'd have brought that up in our environmental scan yesterday.
Yes.
Interesting. Interesting. And but I would guess, I wouldn't bet because I'm not a betting person, but I would guess that most certifications probably saw some sort of decrease um, in their testing, even if it was a small one like the CDIP. I think most of them would have seen something just in that year alone because of things happening with the public health emergency and COVID-19. COVID-19 wreaked havoc on everybody and everything. So, um, yeah, yeah, wow, wow, interesting. So speaking
Yeah.
of AHEMA, um, there you all know that I am on my state association board, and I am part of the advocacy platform. And so I don't know whether or not, hopefully, your state has sent you information about the action items that AHEMA is currently looking at as far as their advocacy. And if they have not, you too can still participate. If you go to and you don't even have to be a member to participate. Any person with a computer can actually, a computer and an address, and participate. Um, if you go to AHEMA and click on the advocacy link, and I think it's usually at the top of the page if you're on a computer. On your phone, you may have to hit like the three little lines or three dots or whatever to open up more um, screen space. But you hit advocacy and then you go to take action. And on that take action page, um, there are four, five, five different, well, actually, there are six things on there. One of them is where you can tell your story about patient identification. So if you have some sort of story that you want to tell, you can click the tell link and you can type away and tell your story. But the action items that you can write your members of Congress, and trust and believe, is as simple as once you put in your name and address, you get um, an email template that is already addressed to your Congress people. Your name and information is already added to it, and you hit submit. It's just that simple. But you have to click on each one of the action items, and so one of them is they're repealing Section 510 and support patient identification efforts. Again, they've been asking for this one for a minute, and for whatever reason, one year it was removed, but then it came back, and so they continuously, I guess, keeping this in the forefront and putting this in Congress folks' ear, getting them to repeal Section 510 of the Labor HHS Appropriations Bill. The other one is, and this is the one that you should have received some information about recently, support link to address Social Needs Act. And this is your email support reaches out to your member of Congress to ask them to co-sponsor the link to address Social Needs Act to better integrate healthcare and social services. All of that kind of helps uh, look at some of the social determinants of health and the importance of that documentation and reporting. The other one is support improving seniors' timely access to care act. They're asking them to support legislation that would modernize the way Medicare Advantage plans and healthcare providers use prior authorization, including reducing administrative burden and reducing delayed care. Um, Another one is contact your members of Congress and urge them to support the Improving Social Determinants of Health Act of 2021. Again, this advocates for the Improving Social Determinants of Health Act to improve the capacity of public health agencies and community organizations to address social determinants of health. And then lastly, you have contact your senators today and urge them to support S674, the Public Health Infrastructure Saves Lives Act. And again, this act would work to modernize public health at every level. So those are the advocacy action items that AHIMA is involved with during this time. You can check them. Now, let me just, on the back flip side, what you probably don't know is AHIMA is very competitive. Now, that part you probably didn't know. And they are tracking this. So they're keeping track of the number of emails, or the number, not emails, the number of action items that occur per state. So it's interesting to see who's doing what, when, and where. Now, one of the most vocal state component associations, I think Tennessee, Florida, even Indiana, they always kind of are running in the lead on a lot of these. And so I thought this was a great opportunity to let our folks know that this exists, this is out here. Now, hopefully your people in your state are funneling the information down even to your local level and getting you that information. But if not, you can go straight to the horse's mouth. You can get rid of the gatekeeper and go straight in and advocate if you like. Any questions, comments, concerns on that?
I was going to comment, but it was just about my state president, but I'm not going to do it.
Oh, Lord. I hear the tea. Yes, sir. Yes, sir. Okay. So the other thing I wanted to bring up is I was in my meeting yesterday, and there was a ray of sunshine, and she bubbled in, and she was bubbly and engaging and just all of the things that you would expect for someone new coming in and volunteering to be. And immediately, like I had to turn around, like, who is back here talking and answering all the questions, doing a whole lot. And to my pleasant surprise, she was somebody that looked like me. And I said, well, you better do it. You young millennial Gen X person, you. And so I was so excited by that. But then something in my spirit said, be careful, watch out for her. And not in a bad way, but watch out for her, make way for her. Because unfortunately, and I can only speak for me, I didn't get that. I didn't get the being able to speak. You know what I'm saying? You would be around your elders or older folks or in a room, and it was like, yeah, you can come in and be here, but you better not say a word. you better nod in agreement or shake your head no if you didn't agree, but you were not given the opportunity or the ability to speak. And I was so glad that she had been provided that level of comfort and or entitlements to feel like I don't give a damn whose room this is. I'm walking in. I got something I need to say. I have things that I want to comment on and to do that. And I was so excited. Good morning, LaShonta, and you're never late. Come on in. I was so excited by that. And that just it encouraged me, to say, who, it doesn't matter whose room it is. If you have something to say or you have something to inject into the conversation, which is why I try to encourage you, especially y'all on Clubhouse, where you can't actually come up to the mic and speak, to say something. Oh, I mean, I was so excited by her. I couldn't even concentrate on the rest of the. I was like, every time she said something, I had to, because she was behind me. in a corner. And so I had to turn all the way around and, mask, because I was masked. I was looking like, y'all ain't got no mask. That's a whole other conversation. But I had to turn around and look at her and just, nod to her and, make eye contact with her, kind of affirming her as she, made her way. Because now I can see if, and the, I can, well, let me go back. I can see that if this is a platform for her or something that she wants to further dive into through the years, because actually we were at the point where we were taking nominations for officers. I can see where she has now introduced herself. She came late, but that's another thing. She came real, but you never know. She could have been working and could only get in when she came in. But she came in late. But even then, she said, I'm sorry, I came in late, and so I didn't get to introduce myself. My name is blah 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 blah, and I'm a relatively new grad. And I just felt like this was an opportunity for me to get to know some people and, get more involved in my profession. And I was like, you better
I like
do it.
that.
I love it. I loved it. And I was like, and that's what we need. More people, more, no matter, because initially I'm like, well, we need more younger people, and we do need that for the future, but we need some older folks too. We just need more people to be engaged and be involved and, step up. And we had a break, and at break time, the number of folks that was flocking to her, just, hi, my name is so and so. I just sat back and I was just excited. Like, it was a whole networking thing. It was a whole networking masterclass in and of itself. I'm always looking for master classes, no matter that people call them that or not. Life teaches a whole lot of things, and you can learn a whole lot just by sitting back and observing and looking at things. And I saw that, and I was just so excited for her, and excited that there are people who are engaged and want to, lend their voice and make a difference. I mean, I could just see it. And I think she was part of the young leaders. We have a young leaders committee or something, and I think she was part of that. So I was excited for her, and just excited and encouraged just by her and the conversation yesterday. And I just wanted to, tell you all about that and encourage you, because again, those areas, even at the local level, so even if you don't necessarily make it to the state level, because I know, there's only one state level place and it's a lot going on, but even at your local level, be it AHEMA or OHEMA or AHEMA or AAPC, whichever organization or any other organizations that you may be in, get involved and get engaged, and let folks know who you are. That's kind of one of your first steps. I mean, you could do it, or you could do it within if you're in school or in a class, start small, if you will, just with the group that you are, say you develop a study group, or you find somebody that you can partner with as you go through that experience. And you never know. And I don't want you to think that every interaction or every relationship you have is transactional, where you're expecting to get something from somebody. It's not that. You're just making yourself known and getting information about somebody else, because you never know where down the line you can think of, oh my God, I know that person. And you can reach out, hey, remember we met, or whatever, or something that they're a specialist in. And you know what? Oh, I have some questions about XYZ. Let me reach back, because I do know somebody who is a specialist in XYZ, and that's how your network expands, and expands more than just your friends, your family, the people that you know. I feel like I got a whole network over in Philadelphia, and I ain't even been there yet. I mean, just because we have these conversations, and trust me and believe, my folks know about Mr. Jesse, the coding. They were like, who is that man that you always talking to every Saturday morning? I was like, yes. So, it's just a way to just get to know people, expand your, we always, well, at least I always ask God, enlarge my territory. It's one small way for me to take a step in enlarging my territory and then letting him do what he does. So yes, I just wanted to encourage all of you today and in that. And I don't know if you had something to add. I know you're nodding.
Oh, definitely. Networking is, and I am late to the party when it comes to networking,
I am too,
but
because I'm an introvert. Believe it or not, I am introverted. I do not. I become extroverted when everything comes on. Usually, I'm just. But go ahead.
but networking is key, especially, well, in all industries, but especially in this industry, because you would think that HIM is this huge industry, which it is, but it's also very small.
It is.
And a lot of people know a lot of other people.
They do.
So networking is key, because since I have started joining rooms and putting myself in certain organizations, I'm finding that that's where you look for a job first,
Mm-hmm.
because people post jobs all the time
But
in
even
those smaller
still, even
circles.
more than just posting, and I didn't mean to cut you off, I'm sorry.
Mhm.
Even more than just posting, if somebody knows you and knows your skill set and are comfortable with you, they would recommend the job to you. Hey, we're looking for you for XYZ. Why don't you go ahead, submit your stuff? I mean, and they'll the majority of the positions, I think I've said this before, the majority of the positions that I ever received was because somebody knew me and knew what I do, it can do, did do, etc. And they're like, we want to hire you. We want, just go on and put your stuff in. Or there's somebody looking for somebody. Why don't you call them, make some connections, have a conversation, see if it's something that you're interested in, because we have the position and we think you'll be great for it. And so it's those types of connections that you make that kind of get you into the door. But go ahead, I'm sorry.
No, that's all I wanted to say. Mhm.
Yes. So I encourage everybody. I was just she had made my whole evening. I was on cloud 9 all the way coming back from Columbus yesterday. And one of my daughters was with me. My oldest daughter was with me, and I'm just encouraging her and telling her, like, this girl was in the room and da 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 da, and so and so and so. And it's like, yes, even though my oldest is, I don't know where she get that from, because she's very opinionated and will say whatever, whoever, however. I sit back and be like, well, okay, what she said. um, Another thing, kind of along this vein, is I know that there is, for the last couple of years, primarily due to COVID, but even before COVID, we've had these opportunities where we've worked from home, and we've had home-based offices, and people, we were talking about people not feeling engaged and connected as they're working from home, and some of the things that you can do to even foster the networking in a virtual platform. And one of the things, and nothing burns me more. This happened to me the other day. So one of my clients is getting um, ready to start billing her services, and she wanted a clearinghouse. And so she has no idea about any of that, and she was like, I need you to scout and look and see and do and whatever. And I'm like, okay. So she had a couple of organizations, companies that she was interested in. Price points were kind of right. She didn't know what to compare, how to compare them. And so she asked me, would you take the lead on that? Sure, whatever. So I get in with a training with one. The trainer sets up a Zoom. He never turned his camera on at all. I never got to see what this man looked like, who was telling me, because you never, it was just this little picture. He even showed a screen and walked through. Now he was, other than not showing his face, even if to show your face to say, good morning, I'm so and so and so, blah, 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 blah. I'll be your trainer. If you have any questions, let me know, whatever. And then go back to showing your screen. If I felt some kind of way about that. And then I thought about that. And that was part of like kind of our conversation. How can I engage with you? I mean, yeah, I could easily talk to you, I guess, with your picture right there, but it's not because we talk not only with what comes out of our mouth, but we talk with our body too. That's how I know when I need to pick up my teacup, because I'll be looking at you like, here it comes. So, and so it's like how that's networking 101. Like be in the room, be present, and your presence is being on camera. And I know, and I've heard people say, well, my home is my private space, and it is, and I get it and I understand, but all of these platforms, even the ones that I don't really care for, like teens, but all of these platforms have functionality where you can change your background or you can put something else back there. Nobody has to see what your personal private quarters look like. So there, to me, that's not an excuse to be present and be seen, because at some point you may run into, even though you work from home and even though you have all your meetings online or what have you, at some point you may run into somebody from your job or have some sort of meeting or go to a conference or anything, and you see a name and you couldn't even connect the person, or they couldn't even connect you to anything. They just be like, oh, I know that name, but I don't know that face, so I don't even know if that's her or if that's him. And so I don't understand that. You got anything to say on that?
I think that is a generational thing, because what I'm also real what I hear a lot is like there are a lot of millennials who have social anxiety. So them not being able to connect is a good thing for them, because I guess it decreases their anxiety when it comes to meeting people. So I don't know. I mean, but I agree. Like you do need to. I mean, it's nice to put a name to a face and have some engagement, but I don't. I just think that over time it's going to change.
Wow. So I know. So like with from a social media context or socially, I get that. Professionally though, I don't know. I just it's if I'm in a regular everyday ordinary job and I'm asking you, can I take your order? Okay, maybe. I don't need to connect to all the other people who work at the fast food restaurant where I'm taking the orders from, potentially. In a profession and in a career, though, it's particularly if you're looking to maybe advance in your career or climb the ladder in your career, but even in your own facility, like, because if you are removed from the facility, you don't know the players and you don't see the people and they don't see you. And I don't know. Maybe I am the old school. I don't believe in the let me get. Oh God, I had a boss that was like, I need to be here a half hour earlier before everybody else and be here. Nobody is doing that. But I do think it's a good idea to be seen and folks know. I think because it's recognition. Like I know. Yeah, I was like, exactly. So Vicky said, especially, she's like, especially if the person was a trainer, he should have shown his face. What kind of example is that? Exactly. You're the face of the company that I'm just talking to. I don't know anything about the company. I don't know anything about whatever. And I have only thing I'm taking from that, even though he was great. He showed me everything I needed. He followed up everything. All of that was great. But the initial gut thing for me is I don't even know what dude look like. And I spent the whole hour with you. I have no idea what you look like. And I mean, and the picture, and it wasn't even a professional headshot picture. Let me even say that. It was some skiing, something you was doing, a dog. It was not even a professional picture. So I don't know. I just think at some point, even if it was for the first, couple of seconds or whatever, let me introduce myself, blah, 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 so and so and so. And I'm going to go off camera, blah, 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 blah. And I get that. So I don't know. I just how can you not engage? And I think for managers and management, it's hard. Like, how can I engage with my team um if I don't know them? And I haven't seen your face. I haven't seen your face since you interviewed. If you came in virtually or whatever, it's like, be present. I don't know. I just,
Well,
it's a
I
new
mean,
day.
I've had a totally different experience because I worked at a company for 5 years, and I couldn't tell you what anybody looked like. And I worked with them for 5 years. Nobody, trainers included.
Wow. So did you
I
feel
mean,
connected to the team? Did you feel part of the team? I mean,
oh yeah, because I mean, I'm not really like, I'm not a visual person, so I that doesn't. As a matter of fact, some people I'd rather not see anyway. So that just for me, no.
oh my
Mm-mm,
God, I swear. I love you. I
mm-mm.
do.
And I really do believe that it is a generational thing because I just had a conversation with someone who's a millennial, and she was she's a writer,
Okay.
and she was talking to a potential client, and he was telling her about his dyslexia. So she's always said that she felt as though she had undiagnosed dyslexia.
Mm.
So she was like, I'm gonna get tested, and I'm gonna put down on my applications that I have a disability of dyslexia, and then that way I can that'll make, I guess she's thinking it's gonna make her more employable. I said, can we think about this for a second? I said, you have a hard enough getting a job because you're black. Now you be black and dyslexic, and that's a selling point.
oh my God, I'm about to holler.
I said no. Mm-mm.
oh my God. Look,
That's
you're gonna make the reel. I swear you're gonna make the reel.
as some stuff you keep to yourself, okay?
oh my God. that is priceless. oh goodness. Okay, let's
I
see.
mean, seriously, no. Can you tell me where black and dyslexia is a winning formula?
exactly. Be like, they
Okay,
already think you can't read, you don't
that's
understand, you
all.
know what? oh my God. Okay, she
That's all I'm
says,
saying.
Lashonda says, I'm with you. Some people I do not want to see. she said, yeah, it must be. Vicky says, yes, it must be a generational thing. And etiquette has been lost through time. Oh my God, we can go on and on about etiquette. That right there, Jesus.
Oh yeah.
And she said disastrous. BOL disastrous. oh my God. Girl, right. I'm over here dying because that was funny. like I said, he gonna make the reel this week. Tanika cracking up laughing in Clubhouse as well. Y'all funny. But bless her whole heart. I don't know. And then what else did we talk about? That was pretty much it. But I was just that whole thing with the girl who came in, and then just being, don't hide behind the screen, be seen. That was one of the quotes that somebody came on. So I don't know. I mean, like I said, I'm a shy one too. Girl, that's what makes me bring up my teacup, because I know it's the look on his face. Girl, it's for me too. I be like, oh, here it comes. I see it. I feel it in my spirit. Let me grab my tea because the tea is about to flow. I don't either. So I don't have a poker face either. And so now what I will do, I'll be on camera. And if it's something and I feel in my something and I know that my whole expression about, I will go away and I'll be like, oh, I need to drop off for a minute and put my face and my picture up. But then I'll come back, or whatever. And so I'm not even suggesting that you be there sitting there staring into the camera as you drift off for the hour if you don't have to, but at least be seen, or at least when you're introducing yourself, put the camera on or something. I don't know. I just think that helps in the long run, at least for me. And
Yes.
for me as a entrepreneur, that I don't usually physically go to my clients' offices. Some of my clients are not in my same state. I have clients in other states. Um, it's helpful. It's helpful for me to get to know. And then we'll figure out, oh, I know you from so and so and so. So if I go to um I have a client that I work with on compliance related issues, and they're part of HCCA. So, hey, you're going to the conference this year? Yeah, I'm going. Bet I'll look for you. So even if we go through the virtual conference, I can look through the list, find them, and reach out. Hey, I see you. What sessions? Blah blah blah, and that's how you continue to foster the networking that you built. And so I'll do those type of things as well. I don't know. Yeah, top ready. Girl, I'll be suited and booted from the head. Well, suited, not booted from the bottom down. Be in my running clothes or whatever, because I probably just came in from running or walking. But yeah, amazing. So what else is going on in the world? Oh, before you answer, just want to remind folks, remember, there's a whole lot of ICD-10 changes this year. Please get out there. And especially if you code for a particular specialty, because it's touching all areas, just make sure you are on point and on task with your particular specialty and the guidelines that relate to that. So you still got some time. Everything goes into effect October 1. So just make sure you are well versed in that. CPT coming down the pike too, and one of the biggest things is everything that's happening with the evaluation and management codes. And Lord, just pray. I know I missed y'all too. I was on vacation. I was in Vegas. It was hot as hell. Let me just say this. I have never been it was like 103 degrees on multiple days. I'm like, we would walk out. I'm surprised I didn't get sick, because I don't, even here at home, I don't like to be cold. I don't like to be cold. I don't like to be hot. But going from air conditioning to extreme heat, oh my God. And then we stayed at the Aria, and it was so cold in that lobby. I said, y'all trying to purposely freeze us out? Like, you needed a coat to sit in their lobby or walk through their lobby, and then you needed to be in a bathing suit to walk outside. It was ridiculous. I was like, I'm surprised that more folks are not sick here. But overall, we had a great time. Our anniversary is actually tomorrow. So it was a whole surprise for him. He had no idea where we were going. I just told him to pack a bag. He had never been to Vegas, and so it was my gift to him to be able to surprise him. But he did not give me the response I was looking for. Let me say that. Let me spill some tea. First and foremost, I'm like, if somebody would have did that to me, I would be like, oh my God, this is great. So he was like, like, he didn't know where we were going until we actually walked up to the gate in the airport. But he was so in his feelings that I didn't tell him that we were getting on a plane. So he's not the most enthusiastic flyer. So that was the part that was, so once we got there, he warmed up a little bit, but he was still on edge about, you didn't even tell me we got on the plane. You didn't tell me we got on the plane. What the hell, sir? Just get your ass on the plane and let's go. But other than that, we had a great time. Let me see. She asked, can you suggest a good medical necessity presentation for providers? Yes. Yeah. I'll look for one. I'll shoot you some information. Write that down. Okay. So what else was going on with you this week, sir?
So I have some our ongoing clinical documentation situation and the whole RN thing.
Hmm.
So let me tell you. So I got contacted by Maxim,
Okay.
and they, somebody saw my profile on LinkedIn, and so I'm like, okay. So we, have the little phone screens, and then they're like, well, I have an assessment that you have to take. So he explained the assessment. I thought he said the passing score was 70, but it turned out it was 80. So he said, but in order to retake the exam, you have 3 attempts, but in order to get a retake, you have to score at least above 60%. So
Hmm.
I'm like, okay. So it's 30 questions. So when I took it the first time, I got 77.
Hmm.
Now I should have got an 80 because one question they asked twice, but I changed my answer. You know that you never do that. So they were like, okay, well, you can retake it. I retook it and got a 94
Hmm.
because they tell you what you got wrong. They don't tell you all the answers, but just they just told you that your answer you selected was wrong. So, of course, you can figure out which one it is based on that.
Hmm.
So then he says, okay, well, can you send me send me 2 references? Okay. I sent 2 references. Then he emails me back. Oh, unfortunately, we can't move forward because you're not an RN.
Oh Lord, where's my tea? Did you not hit the fan? Oh, good Lord. Wow.
And I'm so my thing is, look, if that's their requirement, that's their requirement. But I said to him, I said, but what do you think the LPN after my name meant? It's not like I didn't. It's right in my profile. It's on my resume.
Right, it wasn't like you was
What
hiding something or trying to
exactly?
say whatever. It says I'm a code nurse, and nurse starts at LPN all the way through whatever PH. Is it a PHN? Some whatever y'all.
They just use they have PhD nurses now.
Yeah,
Yep,
yeah, yeah. So all the way up through whatever it is. So, sir and ma'am, you didn't do your due diligence in your research,
and wasted my time.
and that too. Wow, wow. So what else was going on?
So then I applied for a home health coding position
Okay.
because I'm like, it's been a minute, and I was only interested in home health because, the people at CMS are busy because we think it's a lot of ICD 10 CM change and PCS changes coming, but
Oh, it's you are absolutely correct on that.
they are revamping Oasis too.
Yes, yes.
So I'm like, you know what? I might need to get me a job so I can get me some really good because of course you can read it on your own, but it's nothing like working with it and having to do it. I'm like, I think I might need to apply for a job and be ready for January. So I applied for this job. Now, normally when people have geographic requirements, it's usually in the ad.
Mhm.
So I submit my application. The lady, emails me. We set up a time to talk. Then, so during now, she never said from the get go. See, this is why, like, I'm just really, really um questioning. These people are really questionable when it comes to these jobs nowadays because we go through the entire interview. Then she says, I realize that you live in Pennsylvania, and we have providers in Pennsylvania, but um, we're required to only hire people who are in states where we have offices. There's only 3 states that they have offices. So we go through an entire interview. I tell you my whole life story in coding, and you mean to tell me you never looked at it until halfway through the interview?
Oh, good Lord. What is happening with these people?
It's the BS for me. It really is because because clearly, if you are required to only hire people from certain states, that should be in your ad. If it's not in your ad, it's because it's not a requirement. That's some bullcrap.
Right, because
I don't believe it.
I've seen ads that it'll say remote for the state or
Hmm.
remote for the particular area. So yeah, wow. She's like, it's in the water at the offices. Wow, I don't understand. Like, yeah, my friend, one of my friends who's a nurse as well, and she had worked in the home health space and was providing advice and guidance, and she was like, and she hasn't been in it for a minute, probably about 6 months to a year or so. And she's like, oh my God, it's all brand new. So it's a whole new thing that she has to learn. And I'm like, girl, buckle up, because it's still changing from what you see today. So
Yeah.
wow. Interesting. Interesting.
Then I also read that next year, Medicare Advantage is going to be the most popular plan for Medicare services. It's going to be more popular than their traditional Part A, Part B
Mm.
supplements. And they were saying that that's a good and bad thing. And I also read that CMS had changed their position. They had a Cigna Health Springs, which is a Medicare Advantage program.
Mhm.
CMS claimed that Cigna Health Spring had improperly coded some encounters and they would due some money. So Cigna appealed it, and according to the article, they submitted documentation, but they never said. All they said was that CMS and stands by the integrity of their process, but they did adjust the amounts, but they didn't say what the amounts were. So I'm assuming that meant that Cigna had to pay either less money or no money back at all. But just say that, because if you're going to air these people out and say they owe X number of dollars, and if they're not responsible, then just say, you can still put your little disclaimer out there, but they didn't disclose how they changed
And
it.
that's not fair. You would
No.
you said, even if you made an error or whatever, then you disclose that. It's okay. We make mistakes, and we were looking for that too, because we were like, there has never been a time where they actually came back and was like,
Hmm.
no, right. Have that same energy when saying sorry. You were exactly right, Shanta. It's like they don't do that, and so that's not right. That's not right.
Mm-mm.
I don't know these advantage. So I know in our state with Medicaid, advantage companies. So, and I'm only speaking, and nothing against them, in the behavioral health space, because that's where I normally encounter them. Um, you have patients. They're always they're always presenting new things to get people to join their managed care organization profile. And so, and these, at some point, I think there needs to be some sort, and maybe there is, I don't know, but I feel like there needs to be something that says you need to stay here for a year. If you join, you need to be part of this panel for a year or whatever. But they flip in and out all the time, following whatever new trick. Oh, they giving away so and so and so. I'm gonna join them so I can get so and so and so. Then next month or 2 months later, somebody else is giving something else. Oh, I'm gonna follow them so I can get so and so and so. It is a nightmare to me, a managing nightmare on the front end, which is why. And here's some tea for those of you who are um, providers and probably solo providers or small group providers, especially in the behavioral health space. Somebody needs to ask for that insurance card every single time because they flip left and right, following the trinkets. And so your claims won't be clean and going out the door appropriately or properly if the person had changed insurance. That's not their insurance anymore. So now you holding up your cash flow, because now you got to figure out, well, what insurance do they have, and then put all that information in, when you can be proactive and make sure you check. That should be part of your process. I need to, because I know when I go to the doctor, they ask me, is your insurance still the same? And if it's not, what is it? Let me see it, get a copy, blah, 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 blah. So, in the Medicaid space, I don't even know if I would say ask the question, is your insurance still the same? I would say I need to see your card. Bring your card to every visit so that we can see and make sure that it matches up. Um, yeah. And so hopefully Medicare won't be the same. Probably not. I don't know.
Well,
But
me,
I'm with my mom. I'm always receiving information about, because I kept her on traditional. I will not flip her over because I feel like it's just different. I'll say that.
when if because I started out in risk adjustment. When I first got into it, I'm like, okay, well, I like the whole HCC categorization. I like that,
Mhm.
and I understand it. But what I'm really starting to see now is I'm starting to think about there's another agenda. I really think that Medicare Advantage is just their way of privatizing Medicare.
Mhm.
And anytime you privatize health care, it becomes a problem
Mhm.
because these companies put profit over care all day long.
Mhm.
So I just think that it's a disaster waiting to happen.
It is, and it's and on the Medicare part, anything, especially with our seniors, some of them, a lot of them, the majority, uh, it might not necessarily, it may be half and half, but a lot of them are savvy enough to be able to navigate and understand and follow. A lot of them are not. And it's like, it's about to be a ride. It's about to be a ride.
Because the sad part is, to be quite honest, and it's always been this way in this, well, for a long time it's been this way in this country, that you either have to have everything or nothing to get the best care. Because to be quite honest, the people, in my opinion, who are eligible for the best care are the very poor who are dual eligible,
Yep.
Medicare and Medicaid eligible,
Yep.
because it covers it across the board. Because with Medicare Advantage, you can't get this, you can't get that, or they limit this, they limit that. So if you can't come out of pocket to make the difference, then you're stuck.
You're stuck. You're absolutely
And it's
correct.
just it's not right.
It's not right. And then I know we're having here in our area, and I'm sure this is the same around the country, and it's so sad with a lot. It was already a sad, dismal situation pre-COVID. I think COVID made it even worse with our nursing homes, and long term care facilities. Um, to your point, our dual eligible population, there are only so many nursing homes. So you have good quality nursing homes with great scores. They're clean, they're exceptional, they're everything. They only have so many beds that they allow for people who are dual eligible, and that's, I think, everybody has to have so many beds. Um, but then if they've met their max for residents in that situation, then where do the other people go? Well, one place they have to go is to the lower quality, or the ones that are not clean enough, or well staffed, etc. And it is dismal in some of those places. It's horrible. It's sad. It's sad. And unfortunately, and I don't know about in your area, I know here we're still kind of segregated in our area. In certain, Sunday morning is a huge segregation here. um Long-term care is kind of a segregated thing as well. So in those neighborhoods where there are long-term care facilities or skilled nursing facilities, um and people kind of gravitate to, well, this is close to home, this is close to my family, this is close to my area, even though sometimes they don't even have family to come see them. That's a whole other conversation. But they stay there, but they're not, they're run poorly. um if they even exist anymore, because a lot of them have been shut down. We've lost numerous um facilities due to whatever reason, primarily I think bad management, bad care, cleanliness, all of the things. They were just like, no, 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 shut the doors, board them up. But where does that leave these beneficiaries? And they're increasing. The numbers aren't getting smaller; they're increasing. We're aging longer. So what happens here? What's gonna have to give? And so I'm nervous about that. That's gonna be another kind of, I think, crisis that we run into, if not already in.
Well, nobody really wants to talk about it, but our healthcare is in a crisis already. And what people just cannot, I don't understand how it got like this because the American public is incredibly naive or on a spectrum that they can't comprehend because
I'm running out
most
of tea.
people most people in this country don't even have health care.
You got
We
that
don't
too.
have we don't have public hospitals. We don't have like I lived in like the place to get the best health care, believe it or not, is in New York City.
I
New
heard
York
that.
City has public hospitals.
Are
Every
they the
borough
only
has a
place that
public
have
hospital.
public hospitals?
That I know of because uh, across the board there used to be public hospitals in every major city,
Mm-hmm.
but they they stopped them a long time ago because everything is about a profit.
I want to be in New York though. It's cold there. They need some in the in
But
the warmer places. But go ahead. I'm sorry.
but they have pretty extensive services for they have public hospitals like their homeless shelter system is unlike any other. So it's you can get help in New York City, believe it or not. And because I think that's partly why they dropped all those people there, from Texas. That's another,
Well,
conversation.
in Vegas, the mental health
Oh
population
yeah,
and
it's
homeless
terrible.
population is
It's
real. I'm
terrible.
like, are there no services here for these people?
No, it's terrible.
You folks be going to Vegas, and I know what happens in Vegas stays in Vegas and all of those things, but somebody need to say something about this homeless and mental health issue of these people that wander up and down the strip all day, all night. I'm like,
But
oh my God.
it's what it is because of the weather.
Right. And warm
It's
climates they flock to. And I get that. I understand that. That's a smart choice. But where are the services for? I mean, because literally I'm seeing the same people because we walk every day. I walk, period. So every day we walked. And I'm looking like, didn't we just see dude? We just saw dude
because
yesterday.
what a lot of people don't understand about Vegas, the only part of Las Vegas that is glitzy is the strip. Don't go 2 blocks in either direction.
Yeah. Well, we went to Fremont, the little Fremont experience place that was further down in the art district. And I was like, oh my God, it was even worse. I said, oh my God.
I
Oh,
was there. I worked. I was when I worked for Novalon. We used to travel to do audits for companies. I was in Las Vegas for a week, and those it was the first time I realized that. Well, at least at that time, that was like maybe 2015,
mhm,
16.
mhm.
They didn't in Nevada didn't limit the number of children that you could have on Medicaid
Hmm,
because some states do limit it
they
now.
do.
So I kept on seeing because I did this OBGYN service. There were women who had like 10 and 11 children, but they would put them up for private adoption for money.
Wow.
I'm like, that's a way to make a buck to have to go through 9 months and then childbirth and uh, what?
Is it worth it? Right.
Apparently, because when I tell you it was a lot of them.
Oh my God. Like, what's your occupation? A birther. I bring forth life
Look,
for
a
you.
surrogate,
That's a different type of surrogate. Because,
but
well, yeah. Oh my God. Wow.
so I just think, oh, because like you were talking about where do the elderly people go who don't have money? There's because I just did a little search so I could be accurate.
Yeah.
They've had a city-run nursing home here in Philadelphia called the Philadelphia Nursing Home that was trash when I got out of school 30 years ago. It is just now closing at the end of this year. I refuse. I worked there once. I refuse to go back. I was like, no, no, no. It has been on the news, but you know how it's one of those places where they know it's bad, but they have nowhere to send the people, so
They just
they're
keep it open.
constantly in problems. They never ever correct the issues because they don't want to spend the money to correct the issues because of the population.
Right.
It they should have been closed down years ago because they had, winter is brutal here in Philly.
Uh-huh.
A dementia patient wandered off. They couldn't find him. It was, I think it was a man. They found him down the street from the nursing home under a car, frozen to death.
Mm, mm. That's sad.
But but the entire country is hypocritical because we claim to have all this love and compassion, and but we don't. Because the thing is, because if we can give the Department of Defense almost $1 billion a year, and they themselves admit that they cannot find $21 trillion, why can't we have universal health care? Why are there people hungry? Why are there people rationing medicine in this country? It's
Or
ridiculous.
having to make that decision. Do I get this medicine, or do I eat today? Do I get this medicine? Do I eat, or do I pay my rent? I mean, it's and also to that, we give a lot of money to other countries in aid, millions of dollars, billions of dollars to other countries, and I'm all for that. But at what point do you not take care of home? I always have to take care of home. I don't know. You're absolutely right. We're very hypocritical and
But people don't demand it. Because it's almost like it's intentional because this is why they force people to take these awful paying jobs just to even have health care. They force you to be over a barrel.
mm, that's
Because if there was universal health care, do you know how many people would quit their job tomorrow?
more than walking out today. Still more than still part of the Great Resignation. Because
Exactly. Oh my God, it'd be terrible.
I don't know about where you are, but the teacher situation over here,
It's
oh,
it's nationwide, and
it's
you know what?
nationwide.
And who can blame them? Because I'm telling you, it is just I don't. I mean, and once again, it's generational because how these people. Well, people don't raise their children anymore. That's just the bottom line. And you
That's
can't.
a whole other conversation. That's a whole look. That's a 2 hour nighttime. Let's dig into it because I've seen some foolishness. Like, well, where are the parents? Because you can't. Everybody want to blame the child. Somebody was supposed to teach that child, and nobody taught that child. And then the person who was supposed to teach that child probably didn't get taught either. So it's a horrible generational. Some foolishness is happening in our world.
Case in point, I forget which state it was just recently. This little girl was being bullied. She took a gun to school. Luckily, they got the gun, but the mother was defending the daughter, talking about, well, they shouldn't have been bullying her. What?
So this child, who probably don't even know how to shoot anything, gonna shoot everybody and everything,
Look, except the person bullying
except the
her.
person bullying her. Casualties on casualties on casualties for however many bullets is in the gun. Wow. Wow. Did they arrest the mama? She should have got arrested.
I don't. They should have, and they need to get child protective services involved in everything.
In everything.
She doesn't even need a cat in the house. Take everything out the house.
I swear I'm out of tea. I should have had the big cup, not the little cute cup today. I didn't know it was gonna be a big cup type of Saturday morning tea. Note to self: keep the big cup handy. Wow, wow. Not she should have had a cat in the house.
Mm-mm.
Woo, Jesus. So this has been good. Any other things you want to bring to? We are at the top of the hour. Bring to like I said, boy, you done made the reel today. Look, I'm gonna have to cut up a couple. I'm gonna have to spend some time and go through and cut up a couple of reels because this is hilarious. Folks are missing out, even though we are spilling tea and giving information. Oh, folks are missing out. Just
But
on you and
we
them.
definitely have to we have to revisit these past races. I want to know what AHIMA is going to do to address it as an organization. I really do.
You are right. I need to I need to see and dig up and start stirring some pots and say, did y'all see this? What y'all think about this? What about this? What about that? Yeah.
Because I know they'll have an explanation. I just want to know what it is.
I bet you. Well, I'm not. I'm not gonna say I bet you. I'm sure COVID will be part of it. Transitioning from, but well, we talked about that because they're in their accredited programs. The student rates are down. There are not a lot of students in their programs. So I mean, of those that do test, or of those that are in their programs to test, I mean, that might be part of it too. You don't have enough. You don't have the same amount. So hopefully, it's an apples
But
comparison.
that's another thing.
Yeah.
Because I did look at the number.
Mhm.
The numbers aren't really that different. In some instances, there were more people who tested in 2021 than 2020.
Really? Oh well. Okay, scratch that. Scratch that thought process. I don't know. So I'm like you. I'd be interested to see what their rationale is behind that.
Because now for some of them, it really might be a numbers thing, but I don't think that would explain that big of a drop. I don't think so. I think it might be a combination of things
I agree.
that just came together for the perfect storm.
Yeah. But then at some point they need to recognize that and course correct and figure out what they need to do to, because that's not a good look. That's not a good look at all to invite or entice people into your profession and or taking the certification exams, because that's, we talked about that from an educator perspective where people are going through the courses and classes and all that, and then they decide I don't need the certification and they don't take it. They don't feel like it's worth it. Well, hell, if you can't pass it, yeah.
Right.
All right
But
then. All right.
but then you have people who also complain about not being able to get jobs even once they get certified, because that's a big issue too.
That's a big issue. Oh, and so many. And I knew this was coming. I knew this was coming with even with how things shifted and COVID or whatever. But there's so many organizations that are reducing their staff. It's a mess out here in these streets. Hospital systems, um, health insurance organization. It's all kinds of stuff. It's about to be even worse. It's bad out here. It's bad.
Yep.
But on a high note, I mean, stick to the course. Stay. There's so many other opportunities and areas to make sure that you are showing your value. Um, be seen, be known. Let folks know what you do, so that you can hopefully miss that reduction. Mm.
The only thing that I think, if I could offer any advice, is I think that for number one, I think that as a profession, especially amongst coders need to be taught more about the entire billing cycle and how they can fit in,
Yes,
because there's room.
that's room.
You don't have to, as a coder, you don't just have to code.
Exactly.
You can do other things
Exactly.
in the billing cycle and still be able to make a decent living. And I think that needs to be explored, because there's room for everybody. There's enough.
There is. That revenue cycle is huge and all kinds of things. So, surely, to your point, yes, we would recommend, particularly coding. Billing is a good choice as well, but yes, we definitely would recommend it. Hey, Tasha, we would recommend it as a great profession and career. Um,
Oh, most definitely. And truth be told, I'm almost to the point. Well, I'm an advocate of both
mhm.
because I think that you have to know. Me personally, I think you have to know coding to do billing properly.
You
That's just
should.
me. You
I
have
think.
people.
I mean, builders are great, but then you're limited. If you're just in billing and you only know billing, then I think you limit yourself to just that front line billing process. If you have the skills and certification of coder, you expand your to your point, your potential in the entire revenue cycle, because you come as an expert on both the front and the back end. And so assisting with denials management, assisting with um the deny or the integrity, I can't think of the name of the revenue integrity, those types of departments and processes. You come in as an expert because you got it coming and going, you got it on both ends. So you market yourself in that arena to be successful on any most pieces of that whole revenue cycle.
Oh, and one more thing, if I could spill some tea,
Spill it.
get your cup ready.
Uh-oh, I ain't even got no more tea, but I got it.
Along those lines, the reason why I recommend that someone like Shirley, I recommend that you do billing and coding and get certified in both, because what is happening is there are a lot of nurse practitioners who are coming into the field, a lot, and a lot of them are they are setting up ancillary businesses. They might work at this family practice, but they might have their own little clinic, or some little consortium that they do on the weekends, and they don't know anything about billing. They don't know, and they might know a little bit about coding, but they definitely need somebody competent to handle their billing.
Mhm.
And also another thing, I'm not interested in it, but if you are interested in credentialing, that is another huge
Ooh,
opportunity.
baby. Right. I've
Huge.
had clients and I'm like, who in the world? Hats off. Because it's a lot. A whole
It
lot.
is.
But it's guaranteed because it has to happen. And it's cyclical because you have to maintain.
And they have to renew. That's right.
Yes, yes,
So
yes.
Shirley, we are giving you some game.
Game on game on game. Marketable medical coder. That's right. That's
That's
right.
right.
And to your point of nurse practitioners, in again in the behavioral health space, um at the state level, they allow other practitioners to set up shop. So you have case managers who are able to bill. Now they have to be billed up under a licensed independent social worker uh, license, but your case management staff can bill, and they're setting up shop to do that. Behavioral health services, you have what are called qualified mental health or behavioral health specialists, who are people, um, you and I can do that. You you can have a high school degree, you can have an associate's degree, bachelor's, master's on up, and each level have a specific modifier that they are able to provide certain services and bill from under the auspices of an independent practitioner. You have the substance abuse arena that is huge, and you see these places are sprouting up all the time, and they're looking for people who provide therapy and counseling. And again, those people can actually bill at the state level. So all of those things, if you know somebody who's a therapist, a lot of them are hanging shingles like, I am a therapist, I can help you, I can whatever. And through the state, they can bill those. Now, do they know how to build those? Aha. That's where you have those conversations. Let me introduce myself. Again, networking. Let me introduce myself because I may be able to help you. Let me show you what it is that you need to do. And most of them, there are, depending on where they are, if they're licensed social worker or if they are the qualified mental health, there may be an isolated number of services that they can bill. So it's maybe like 2-3 codes that you actually dealing with. But others, depending on how far out they are, there are a list of codes. And so they need to understand how to bill those, how to code, how to document. Let's go back to documentation. How to document those services, how to code those services, how to build those services. You said right there, get 2 or 3 of those type of shops rolling.
And Shirley had a question. She said credentialing question mark. So Shirley, credentialing is every provider that bills an insurance company has to be credentialed or basically has to be approved by that insurance company to submit claims. You just cannot say I'm Dr. So and so and send Blue Cross Blue Shield of Ohio a bill.
Correct.
They will look at you like, who are you? So, but in order to be reimbursed, you have to be credentialed through them and you have to have a signed contract where you agree to a contracted rate and all of that. So, what a credentialing person does is they facilitate the paperwork, and they're like clearing houses that people put their information in, that commercial insurances go to, and they usually start with Medicare because that's like the king of the hill. They do Medicare, Medicaid, then they do commercial insurance and if they are already approved for Medicare and Medicaid, that helps expedite the process for commercial insurance approval. And then also another side note about nurse practitioners. Nurse practitioners are pushing now in a lot of states for full practice authority.
Ooh,
so they can,
I hope they
so
get
they,
it too. I hope they get it.
Yep. So they can come from under MDs, and that's going to open up. Once that happens, you're going to see a flood of MPs.
Yes.
So that's why I'm telling you,
yes.
if you get into knowing billing or you get into something else where you can offer some services and start your own business, baby.
Yes. Yes. It's the
floodgates. They're pushing hard. They're pushing hard for full practice authority. Some states have it, but it's not nationwide yet. But I think it's coming.
Yes. Yes. So that's exciting. So that leaves us on a great note, an optimistic note. Because we are positioning ourselves to be right there at the forefront of whatever the movement is and what it looks like and how we can help. We can help you get to where you need to be in order to help those that you know get what they need. So yeah, I love it. As we spill the tea here every Saturday morning.
Yep.
So, Mr. Jesse, do you have any other closing thoughts before we close out today?
No, I'm just grateful that you created this space, and I'm glad that we can share some real information and really give some quality reflection, some quality advice, and some quality education.
Yay, we did good. We did good today. So again, thank you all for joining the Saturday morning tea. Was the tea spilled? I think we spilled some tea. We just sprinkled it all throughout the hour. I just feel like tea was just everywhere. So if this information was valuable and helpful, yes, we do. We do. Thank you. Appreciate you. Appreciate you.
Yes.
Like y'all know y'all stuff. Girl, let me tell you, you'll be surprised. Because I get side-eyed by my husband all the time. Like, you on the computer, you still researching, you look. Yes. I look forward for not only me, but to be able to share that information and give it to you. So yes.
That's right.
Because most of the times, where do you get it? Who tells you where you need to go, where you need to navigate, what it needs to look like? Who is telling you that? Nobody. You know how my friend likes to talk about those gatekeepers. Okay, that's a whole other conversation. Anyway.
Yes.
If this information was valuable for you, help us share this information with others by liking the video, sharing the video. You allowed to cut it up. If you see something funny and you want to cut it up and share it, feel free to do that. Especially if you in the YouTube space. You may be able to do it on Facebook too, I think. I don't know. But even and on Clubhouse, I allow it to be cut and re-listened and all of that. So you can do it however you choose to. Or share the entire video, whatever. And then also subscribe to the channel or get others to subscribe to the channel if they need to hear this type of information. And also check out the channel Professional Reimbursement Network or any of my channel handles at PRN Coding EDU. Also check out the Coding Nurse channel on YouTube. Brother Man dropped some gems over there as well, and y'all already know he comes with the tea. So You'll be surprised of what you see and hear over there on the Coding Nerds channel on YouTube. And last but not least, to my Clubhouse folks, make sure you click on the greenhouse to join in on the fun. And in our particular club, and I don't do it regularly, but I said I was going because I only put my Clubhouse on my iPad and I need to have it with me on my phone because I can jump in and just act a plum fool every now and again just to say hi. But anyway, and I may do that. um, so click the little greenhouse to join our club, and you will be notified of any live broadcasts that we have. And we typically have our live broadcasts on Saturday mornings at 9 a.m. Eastern Standard Time. So feel free to come on in. And then don't forget to follow each other. That's one small way of networking. Is just you see somebody in the club, if they're interacting or or even if they're not, follow them. Everybody follow each other so you can also get your engagement up where other people can see and get to know you, especially if you have valuable information that you are sharing as well. So follow. It takes nothing to follow. I think I follow everybody in the room when they come in the room. If they stay here long enough for me to look at them and get them, I'm gonna follow you. So just follow everybody in the room. So this has been a great session today. I appreciate you all for being here and joining us. And remember, be safe, be kind, and don't wish for it. Work for it. Until next Saturday, take care.
Absolutely. Bye, everybody.
Bye. And hang on, sir.
Yes.